Can you discuss what baseline tests you would put in place pre-season for an athlete to use as measuring tool in case of a concussion during the season? No, these are my secrets. No, I'm just kidding. Yeah, okay. So generally when you're doing a baseline test on an athlete, a lot of people make the mistake of thinking that if you just do a computerized test, that's good enough. All of the evidence on baseline testing and preseason testing shows that a computerized test, which is there's a few different versions out there of different tests that people do. A computerized test by itself there's issues with it. They have issues with test-retest reliability, and they're not able to test the full spectrum of what could potentially be injured in a concussion. So even the manufacturers of these tools suggest that they are meant to be one component of what should be a more robust, battery of tests. Like anything, when it comes to healthcare or medicine, if you're only going to use one test, you're going to miss a whole bunch of stuff, right? One example that I use is, let's say you, for our physiotherapists out there, let's say you think somebody has a meniscal injury in their knee. And if you were only going to do one orthopedic test, your diagnostic accuracy would be minimal. Whereas if you were to do 5 or 6 different tests that would help you to now go, okay, I'm starting to see a pattern here where now it definitely is a meniscal tear. Or I did this test and it was positive, but these other 5 were negative, so I'm starting to think it's not a meniscal tear, it might be something else, right? Because there's always a margin of error with any test that you do. So the trick is to find the best battery of tests that you can utilize to help arrive at your diagnosis, right? Like if I do blood work on somebody, I may pick up some abnormal things. And then I'm going to say, you know what, this is indicative of this. I'm going to do some more blood work in this area because these 2 things are out of whack. And then you're going to see some more findings. And that might lead you to get a urine test. That might lead you to do an ultrasound on somebody's abdomen. And then that ultrasound might show a little thing. That might lead you to get a CT scan and then maybe a biopsy and eventually lead to the diagnosis of whatever it may be. But if you were just to do a urine test or you were just to do a blood test and then try to make a diagnosis from that, you're going to miss a whole bunch of stuff, right? So it's the same thing with concussion. So relying on any one test is going to be insufficient. And a lot of clinics are just doing computerized testing. A lot of schools are just running computerized testing and saying, hey, everybody come in and do this computer test. That's your baseline. But you're going to miss a huge portion of potential concussion injuries if that's all you're doing. And you're also going to make clearance decisions way too early in a huge portion of people if that's all you're doing. So when you're doing a baseline test, you have to think about what areas could be impacted following concussion. And you want to try and encompass all of those areas, and you want to have a multifaceted approach, right? If you're only doing computer tests, you're going to miss balance, you're going to miss ocular motor tracking, you're going to miss a whole bunch of stuff, strength, motor strength potentially. So what we've done at Complete Concussion Management, we've gone through all the different tests that are out there, tried to find the test with the best test-retest reliability, right? And nothing's going to be effective beyond 8 months to a year or so. So you're going to have to retest people every 8 months to a year. We've had a hard enough time trying to get people to come back year after year after year to do this type of testing. So 8 months is going to be a stretch. I mean, if I had my way, I would have people tested every 6 months, because after that period of time, especially when you're dealing with adolescents, they're going to get bigger, faster, stronger, etc. And you're not going to be able to have accurate results, right? If I test you in grade 10 and then I don't see you again until grade 12, well, your grade 10 results don't mean shit, because as a concussed grade 12, you're probably better, faster, bigger, stronger than your grade 10 healthy self. So it doesn't really help us, right? So you have to do this pretty frequently in order to have it, and you have to have a good, robust picture of tests. And you also have to think about the longevity of those tests. And what I mean by longevity is, if you're to get injured today, how long are you going to show impairment? Like, what's the sensitivity of that test? And for example, the SCAT test, a lot of people will do the SCAT test, which, for those that don't know, stands for the Sport Concussion Assessment Tool. This was developed to be a sideline test, meaning that at the moment of injury, I can test somebody, right? And in order to have, the results on this show that it's better if you do have a baseline versus comparing to a normative. And having a baseline, again, for those who don't know, is testing people when they're healthy so that you know what results to expect. So if somebody does have a suspected concussion and I test their balance, well, I need to know what their balance is normally in order to, see how much variation there is there. So with the SCAT test, for example, the issues normalize, right? So balance, there's some memory testing on there, there's some concentration testing on there. The research on this shows that the SCAT test normalizes after injury in as little as 3 to 4 days. So if I'm trying to use that test to make a diagnosis right on the sidelines, sure, that works. But if I'm trying to use that test to make a return to play decision, that test sucks, because the symptoms of a concussion will typically last 7 to 10 days. When my baseline becomes important is trying to make a return to play decision afterwards, because we know that the healing of the brain takes longer than it does for the symptoms to go away. So now I want to know, okay, the symptoms are gone. How's their function? Well, I can't use the SCAT test because it sucks, because it's only 3 to 4 days and then it normalizes. It's not sensitive enough to show me things beyond that. So the SCAT test, helpful for diagnosis, not helpful for return to play. So what else can we use? Well, we can use, let's say, the BEST test, which is part of balance, which is the balance error scoring system. That's part of the SCAT. That normalizes again in 3 to 4 days. But if you look at a force plate and you look at center of pressure area, for example, which is one of the tests that we use, that doesn't normalize for 3 to 4 weeks. There you go. So now the force plate can help me make a diagnosis, but can also help me make a return to play decision. So I would definitely want to include force plate data and postural sway into my assessment battery. Another one, reaction time. We use a simple dropstick reaction time test, which was developed by the University of Michigan. It has excellent test-retest reliability, and it shows that it takes 14 days to 21 days to actually normalize after concussion, and in some cases actually even longer than that, up to as long as 50 days to normalize. So good test for diagnosis, good test for return to play. We also use a test called the King-Devick test, which is an ocular motor tracking test. This test has been shown to be one of the most sensitive concussion tests on the sidelines, and also shows dysfunction in concussed patients for weeks after the injury. That's what we want. So it's good on the sidelines and it's good for return to play. Okay? So generally our baseline battery, you need to think about it in that full way, right? If you're only going to do tests that are meant for the sideline, you're going to have a terrible time making return to play decisions. If you're only going to use one test and think that that's good enough, you're going to miss all the other components, right? What if somebody gets a concussion that affects their balance system, but the only test you did was a computerized test that doesn't look at balance at all? Well, this person may look like they've normalized and they're back to normal and they're ready to go, but yet they still have balance impairments that you don't even know about. So now you're making a return to sport decision with no information, right? So you need to look at everything that a concussion could affect: balance, reaction time, vision, ocular motor function, processing speeds, cognitive function, memory, concentration, executive function, all of that stuff. And you need to have something that can see that in the acute stages, but also after the symptoms have gone away. All right. So when you're making your initial diagnosis, they find that the most sensitive piece of information you have is somebody's symptoms. So a lot of times people will think that having a baseline is purely meant for making your concussion diagnosis. You don't need a baseline to make a concussion diagnosis, because somebody's going to come in and they're going to say, I got hit and I have symptoms. That's a concussion. I don't need to put you through 15 different tests to prove what I already know. When the baseline becomes more valuable is if the person is denying symptoms, right? They got hit and they're off balance and they're coming off the field and you're like, okay, you got a concussion. They're like, no, I don't, I'm fine. And you have to do something to try and show that, yes, they do have something wrong with them. You can do a baseline then. That's when it helps you with your diagnosis. But the most important piece of having a good baseline is actually after the symptoms have gone away and you're trying to see when they're safe to return to sport. So now you test them over here.